Welcome to Startup Health TV. This is a special health innovation update. I'm Logan Plaster, editor-in-chief at Startup Health, and I'm joined today by Chris Cutter, CEO and founder of LifeDojo. Chris, thanks for joining me today.
Thanks for having me. Appreciate it.
So LifeDojo is we've talked before, is a habit change app that uses behavioral science to help people get healthy mentally, physically. You work with some of the biggest tech companies like Adobe to help people learn meditation, cut sugar, get fit, be more grateful. The list goes on and on. I think there's 30 different offerings on the app currently. Is that right? Did I do that right?
You got it. Physical, mental, and emotional health. And it's up to the user, not up to us. So they work on whatever they want to work on. That's the idea.
So what I want to talk to you about is kind of where the product is now, how COVID kind of impacted LifeDojo, what the evolution of the last 4 or 5 months have been. In this series, we've talked to companies that have pivoted, that have refocused on their core mission, have done both at the same time. This has been an intense time for every health entrepreneur. So take me through where LifeDojo is at currently, the current offering, and as a way of kind of getting into how have things changed over the last, let's say, 4 or 5 months.
Yeah, great. Well, I don't think any company hasn't been impacted by the past 4 or 5 months in different ways. Health and well-being, both in the employer space, which is our primary target, as well as the consumer space, I think has been impacted more than most, right? And so I'll start on the B2B side. As you said, a lot of our clients are high-tech companies. We also have Fortune 500 companies like Berkshire Hathaway using the platform, which is more of a white-collar factory industrial mix, right? So those two populations have been impacted very differently. But I'd say the majority of the folks that use our app and the majority of our customers in B2B have shifted from a balance of physical health and mental health interest. And I'd say 30% of the physical health folks have restarted their program, relaunched their campaign around mental and emotional. And I think that is a fair thing to do. And even the folks that are working on fitness goals or healthy eating goals, the coaches have reported that most of the conversations become about mental and emotional health pretty quickly.
You mentioned the coaching element, which I think is important to drill down on. So this isn't just an app where I get advice, sort of automated advice. There's an actual coaching element. Remind me what that looks like.
Yeah, sorry, I'll give you the quick pitch, right? So you as the user, download the app, it's iOS or Android, and it's a 12-week program to work on whatever goal you've had. So whatever your New Year's resolution was, go in and do that. So it could be drinking water, could be making more friends. The most popular one in healthy eating now is cooking more at home. So it gives you an idea. You're partnered with a coach that you choose. So every person gets multiple choices for a coach. You swipe through them just like a dating app, and you find the person whose bio speaks to you and whose expertise speaks to you. And you can talk to them over the phone every week. You can chat with them unlimited. And then we have coaches that are also facilitating 20 other people that also want to cook more at home, and you're all working together on that goal in the app. And every single week is a different theme. So, week 1 is start small. Week 2 is your environment and how it influences you. Week 3 is social. How do the people influence you? And by the end of week 12, you have fully embedded this new behavior in your life. And that's why we call it a habit. Habits are automatic. So it's not about motivation, it's about doing it. So going back to B2B, the shift to mental health has been significant. And what's really interesting is last year, I think a lot of analysts were talking about well-being as losing attention and things shifting more downstream towards clinical.
Productivity measurements?
Yeah, so productivity, healthcare costs, and employee engagement was sort of looked at as too fuzzy and HR was fighting for well-being budget and being told, maybe you should spend this on a diabetes prevention program. And we've seen this dramatic reversal where even existing customers who, were fighting the good fight for wellness budget, all of a sudden saw their budget doubled, and everybody's asking them, what are you doing with well-being? So I think we're seeing a resurgence of focus on mental well-being, especially, so mental and emotional, but also recognition that physical well-being, fitness and healthy eating tie into that. When people are working all day from home and you have families and you have stressors that didn't exist before, talking to a counselor is one step that's valuable, but trying to create your own lifestyle in this new normal has gotten employers paying attention. At the same time, go ahead.
Is it almost like they're starting to see this as the office perk that, so many tech companies put a lot of effort and time and money into creating environments that were, mentally enjoyable and rewarding to their employees. And now that's been stripped away, and they need to figure out these ways, these sort of these benefits that can kind of compensate for some of that.
Yeah, I think that's exactly right. So, the free food, the free lunches have become, you can send people a box of food, I guess, but ultimately it's less meaningful.
Mm-hmm.
The gym that was on site is no longer available, right? And so a coach helping you figure out how to do strength training at home, I guess you just pick up your notebook and your screen, because that's all you got that weighs a lot, So it's a real adapting to the new normal is sort of the theme that our coaches use. And yeah, a lot of the things that especially tech workers have lost in perks, you're seeing that budget reallocated. And that's really a good thing for us. And I think it's also, occasionally you read a New York Times or New York article about how this is an opportunity to reevaluate as a society what's important.
Yeah.
And I do like the movement towards recognition that well-being matters, because it does.
What do you think will be the metrics that will be necessary to make sure that this sticks and doesn't go back? Let's say 6 months from now, we're back in the office and budgets change and get reverse allocated. What are those metrics that are going to prove to the company, no, this has got to stay?
Yeah. And this is something we care very much about, is primary prevention or well-being in itself. You can make arguments around productivity and employee engagement. And if you are sophisticated, you can go into the healthcare cost reduction argument. What we see well-being as both an end unto itself as well as a means to engage and refer people to the more clinical solutions as well. So we recently had a 3-year meeting with one of our clients where we sat down and we said, okay, here's how many people we've enrolled over the 3 years. Here's how many people have participated in 3 years. Here's some health outcomes that were measured every 6 months for 3 years. Here's the 43% increase in referrals to your clinical counselors for your high-risk population. Mm-hmm. And then we actually had that EAP provider on the same call saying, and here's how many people who had depression or anxiety that we were able to alleviate. And when you can combine the primary prevention value and the clinical value and say, we can't do this in isolation, it has to be together, you can make that argument for you have cut the catastrophic care events down by 30% over the past 3 years, right? People going to the ER because they're having a major episode or try to hurt themselves. These are catastrophic mental health events. And all the stuff before that is how you prevent those events, which are expensive and tragic, right? So that's really what needs to happen more, is a sort of collective argument rather than just a primary prevention argument.
When you've had those conversations so far, have they been well received?
Yeah, very much so. And I think the the tradition of corporate wellness has always been to argue it's an end into itself. And I think if you look at some of the research and some of the bad press with employee well-being over the past couple of years, it's when vendors have tried to argue we are the be-all end-all, and we will save healthcare costs and save your company. And it's recognizing that high-risk individuals need a lot of support, and they need a prevention coach, and they also need a counselor, or they also need a nurse to help with something serious like diabetes and type 2, obesity and type 2 diabetes. That's a lot to carry for a prevention coach, but if you do it together as a care team, you can do a lot.
Yeah. So we've talked about sort of the B2B side, talking to enterprise clients who have reallocated funds. But I know that you've recently launched direct to consumer, which is kind of a different animal in this market. So talk me through that process. What made LifeDojo decide to go direct to consumers, and what were some of the challenges of that evolution?
Yeah, well, I think we've been thinking about this for 2 years, and we are a social mission company, and we felt that having to work at a top company to get access to a coach that can change your life is sort of a sad gate, right? It doesn't need to be there. And so we did launch LifeDojo direct to consumer on March 1st of 2020. So you can get an idea of the timeline as related to COVID. The short of it is the numbers are a lot better than we expected, especially out of the gate, to after 3 months have the cost per click and cost per engagement and cost per install and trial to paid conversion and the retention rate that we're seeing all tells us that we are onto something, and we just learned how to do direct to consumer 6 months ago, right? So I'm still in the evening times reading like direct to consumer articles to sort of catch up on the sort of industry and tactics. But at the end of the day, we have real value that we've proven out with 100,000 plus B2B users, that if you stick with LifeDojo for 12 weeks, you can transform your life, right? People losing 50 pounds, people no longer being depressed, people talking to college friends they haven't talked to in 12 years, right? Yeah. That's the sort of value. And so if there's this tremendous value, it's just communicating that value to everyday consumers. And we've certainly seen certain segments engage more than others. It's a lot more men than we expected. I think it's like 60% men, 40% women. And it's the sort of 25 to 55 range. So it's a pretty broad range. It's Midwest and coastal, so it doesn't really isolate to one place. We have a survey that's been filled out by thousands of people already. The number one goal is weight loss. The number two goal is making more friends. So we compare ourselves to the players out there that are just doing meditation, that are just doing weight loss. And we say, wouldn't it be nice if there was one place for you to go for years to come, whatever your goal is, because it's going to change. And by the way, you're probably going to fail a couple of times, right? What can you do next? And we want to be, it's like buying a home versus renting, right? Like you need a home for self-improvement. And if you talk to someone that does martial arts, the dojo is a place you go for decades, right? It's not a one-hit wonder kind of thing. So we're excited about that opportunity.
It's fascinating that the second most desired module is making friends. We've been talking a lot just with various people over the last couple of weeks about isolation and loneliness and different companies that intersect that, but also just the way in which the pandemic has highlighted the problems of isolation and loneliness. What are some of the elements of that module? I'm just curious, as someone in this field, what does it look like to go through your, making friends module?
Yeah. So the first week is these sort of custom animations where we just go through the science in a really interesting way. Here's how having one friend that you can trust with things that are not going well. So not Facebook, where it's like everything's great, right?
Mm-hmm.
Who are the people you can turn to when things are hard? And if you have one of those, your physical health, mental health, emotional health is better. Your focus, your executive functioning, your brain, your body, your chemicals, everything works better. If you have two, it gets even better. If you have three, it gets even better, out to five. And so you can get 5 people in your life that are authentic, strong connections. You can be resilient to a lot of things, losing your job, losing your home, huge offsets, people in your family passing away. If you have people to turn to, it's a game changer at a biological level and a psychological level. So we get into the really interesting science of it. And then the coach gets in and starts to ask a bunch of questions. Who are the people that mattered most to you? Who are the people you care about? Who's around you now that you care about? Who are the toxic people in your life that you feel like you need to keep up appearances for, but aren't true friends? And then it's creating a plan. So we've had people, can't do this now, but we've had people fly to Vegas and see friends they haven't seen for 10 years. And then creating a WhatsApp group. And the coach is literally there all the way. Like, what about doing this? What about a party here? Like, it's very much
wow, it's very hands-on.
Yeah, it is. And by the end of the 12 weeks, it's not just I've talked to people once. It's what's my plan to really get to the depth of relationship that matters to impact one's life significantly.
In the landscape of digital habit change platforms, is LifeDojo on the more hands-on side of the spectrum? Would you say that that's a distinguishing factor?
I would. Having a coach, my background is in social sciences, and I'm also a social worker. And so I know the research is very clear. Without a human being involved, change is very difficult. And, we do sometimes stand on our pedestal and say, there's not many digital only interventions that really work. They can make you feel good in the moment. They can be nice for a couple of weeks. But if you're looking to fundamentally change habits that you've had for sometimes decades, it's hard and it's dynamic. And if you knew how to solve them, you wouldn't need a solution. You really need outside thinking and partnership and reflection to get there. And that's what we're about, is that high touch support.
Yeah. The big shift that you've mentioned so far from COVID coming was this doubling down on budgets by enterprise clients saying, yeah, this is really a necessity for me. Are there other ways that the pandemic has fundamentally shifted your thinking, either about the business that you're in or just about the people that you're trying to serve?
Yeah. Well, I think the mental health trend is something that matches our roadmap to a certain extent of, either partnering or building ourselves a more full platform for mental health. We'd love to get to a point where it's just completely seamless to go from mental well-being to talking to a counselor to maybe this person also needs to go into their health plan and book some real time over a longer period. And so that's something we've been working on and don't have a launch date for, but that is certainly a priority. And I think it's just affirmed by where we are now. But at the same time, the direct to consumer metrics are such that we are seriously considering, that being a much more of a focus over time. And again, from a social impact point of view, being able to, we've had schools reach out, we've had nonprofits reach out, we've had all these different institutions that would be willing to pay on a per participant basis to try and bring this. And we're not locked into the employer model, which is a very specific model and we love it, but now there's so much more flexibility to work with providers and schools and universities in a more bulk package way. So here's 500 licenses. We can do analytics for you to tell you how it did, but it's a much more, it's ready to go. Just here's your licenses, and people can go to the App Store and download and go. So I think that it opens up so many more possibilities. We just don't want to lose track of our primary focus, which is employers.
Yeah. It's so interesting to think of the ways that a crisis can bring clarity. Just this idea that on one end, the pandemic created a crisis of isolation, and yet because it gave us clarity about how much that's foundational to well-being and health, now we can actually look at it and deal with it. So like, we may have needed something to help us understand this is something we have to invest in, take time for, think about. I mean, to get well-being into schools in a really integrated way, it would have taken something of this magnitude, I think.
Yeah. In the schools are fascinating. We were talking to an influencer in the physical education world, and we thought it was, this is for remote learning for the schools that are being shut down. And the PE teachers are saying, no, all of the sort of distancing of desks, that's going into the gym. So we've lost our education space. We're now going to be in classrooms, and what the heck do I do? So there's a lot of changes that also create constraints that could shift things dramatically in different industries. Yeah.
Interesting. Okay. Well, that's the time we have. Last question. What are you most excited about for LifeDojo for the latter half of 2020?
Yeah, it's the continuing global expansion. So we have tripled our countries in the past 4 months. We've hired coaches all over the world. And I think I'm just excited. We just launched 6,000 people in India are using LifeDojo. And it's to have India coaches talking about ghee and too much rice and like just all this amazing difference and still being able to deliver behavior change, because the behavior change is universal to humans, right? So we're continuing into APAC, and we're opening 3 countries in Africa this year. Just really exciting stuff on the global side. So
that is very exciting. Those are through corporate clients? Employers.
Yeah, but it's also B2C. Yeah, direct to consumer. Every time we launch with an employer in a new country, we also make it available direct to consumer because the coaches are now there.
Awesome.
Yeah.
Well, that sounds like that's pretty new. So that means next time we talk, I'll be checking in on lessons learned from India, from Africa. One of our big emphases at Startup Health is just this shared global knowledge, and I know you'll be bringing things back from those places to LifeDojo. So a lot of great lessons to learn.
Wonderful. Always a pleasure. Thank you.
Chris, stay well, be healthy. Take care.